Joanne, you started the low back boot camp, 6 week boot camp, a couple months ago, I think.
That's right.
How were you in terms of your symptoms before you started the program?
I had a lot of pain, mostly my lower back, and it was almost constant. Almost everything I did, I would feel the pain, except maybe lying down or sitting properly. But I did need a lot of help with ice packs or warm packs. So I can say that it was curtailing my daily activities quite a bit.
How long was that going on for?
Actually, I've always had back problems, but they were mild and I could deal with them. But I'd say the last 6 months, the problem got worse and worse. It just kept getting worse until it was at the unbearable stage that I couldn't cope with it. So,
What was the pain level when at that stage, the most recent stage, I guess, before you started the program?
before the program, I would say 9 or 10 anyway.
Okay.
Yeah,
All right.
it was pretty
Okay.
tough.
And then we took some x-rays.
Yes, we did.
Then we found a little bit of degeneration, almost, and we call it adult degenerative scoliosis. So you had a little bit of degeneration on one side, and that caused a little bit of a curve, which you hadn't really no idea about before, right?
No.
Yeah, and we talked a little bit about a history in terms of you didn't have that as an adolescent, which is the most common form when it usually occurs. So this is more of an adult manifestation.
Right.
So we talked a little bit about trying the program to just increase your flexibility and your strength, right?
Right.
And we started week 1 with some
That's
stretches. And I do recall you had some discomfort doing the exercises initially.
Yes, they were difficult.
Okay.
And the one thing you didn't mention, I have bone spurs as well, and I don't know and I sometimes think maybe that's the most painful thing. I don't
Yes.
know.
You do, yeah. And the
If
bone
that
spurs is your body trying to stabilize that area. So it's like putting concrete around a brick to
Right.
reinforce it for sure.
Okay.
Yeah.
Yeah.
Okay. Now, did you find the exercises difficult at the beginning?
A little bit.
Yeah.
Yeah. I'm used to doing exercises, but some of these were different from ones I'd done before, so a few of them were a little bit difficult.
With most patients who do this, I would say the first 2 or 3 weeks are a little bit more uncomfortable because you're trying to expand range of motion, stretch muscles out that aren't used to stretching out. Did you notice that as well?
I did.
Okay, so it's a good thing I told you about that then.
Yes, it is.
Oh my goodness! So every week we added 3 or 4 exercises, and your routine was to try and do at least once a day, maybe twice a day.
I did it once a day faithfully.
Okay.
A couple of times I did get the second one in.
Okay.
Basically, I did stick to the once a day for sure.
Was it a tough commitment, or was it okay?
No, it was, I found time. Usually I go up and take a little break during the day. So I've used that break to do the exercises.
Okay.
And actually I found it quite relaxing for the most part too, doing them.
Absolutely, and once you memorize it, it's kind of almost like a meditation, right? Because you have no choice but to kind of just let go.
But most of the time I did have the papers right there.
Oh,
so I
did
could
you
sort of
see?
stick to it.
It's a good thing I gave you a
And
copy of
once
it.
in a while I'd have to just check and make sure I was doing everything properly. Because you get sloppy sometimes and aren't doing them exactly the way they're printed. So I wanted to make sure
Okay.
on that once in a while.
Now, your initial pain when you started the program or discomfort, was it different from your back pain, if you know what I mean, or was it an aggravation of your previous pain?
I think it was an aggravation. It did feel much worse and slightly different
Okay.
kind of pain.
When do you start to see a bit of a turnaround in terms of less pain?
I think after about 2 or 3 of going on the exercise program, I felt a bit more limber in general, and I think that helps the whole situation.
For sure. So about 2 or 3 weeks in. Okay.
It was pretty quick, really.
Yeah. And at about, let's say at the 6 weeks, how did you feel in terms of pain level? Because it was kind of a 9 or 10 when you started.
It was probably more like 6 or so.
Okay. All right. And what is it today?
Today, I think I'm at 1 or 2. There's still pain there, but
Mhm.
it's much less.
Okay, good stuff. Did you also find that you're more stable in terms of your balance?
I think so. I
Mhm.
think I did feel a little more.
Okay, easier to get in and out of chairs, that type of thing,
Yeah.
as well, the transitions?
Yeah. Hmm.
Okay. So if you're going to recommend this to yourself in the past, would you have recommended it?
Yes, for sure.
Excellent. All right. Thanks so much for that, for the feedback. We appreciate it.
Okay.